Smiling Minds Mindfulness Meditation by Jesse, Alex, Lexi, and Amy. Moving on to the introduction. Herbert et al. Compared cognitive-based therapy to ACT in 100 outpatients reporting moderate to severe levels of anxiety and depression. The participants were randomly assigned to either ACT or CT groups. Improvements across the two groups are equivalent. The results of the study suggest that ACT is a viable treatment option. Literature review consisting of 39 studies totaling 1,140 participants receiving mindfulness-based therapy. Overall, mindfulness was effective for improving anxiety and mood symptoms for pre-test and post-test treatment. Results suggest that mindfulness-based therapy is a promising intervention for treating anxiety and mood problems in clinical populations. This study evaluated 3 sessions of mindfulness-based intervention on students containing symptoms of stress and mindfulness. 78 students were part of this mindfulness intervention, and 109 students not seeking counseling services were part of the comparison group. The 78 students reported increased mindfulness and decreased symptoms of depression, anxiety, and stress. These results maintained 3 weeks after the intervention. Literature review of brief mindfulness interventions of randomized controlled trials assessing anxiety, depression, anxiety, and stress. The analysis revealed a small but significant effect of brief mindfulness training on reducing negative symptoms compared to control groups. Kavanaugh et al. Examined a brief online mindfulness-based intervention to see if it would increase mindfulness and reduce stress, anxiety, and depression in students. The results showed 104 students were randomly assigned to a 2-week self-guided online intervention or a waitlist control. Participation in the mindfulness intervention resulted in decreased stress, anxiety, and depression.
On to methods. Their participants were 4 college students, 1 male, 3 females. The dependent variable was depression, anxiety, and stress scores. The independent variable was the mindfulness meditation exercise, Smiling Minds 10-minute exercise. The design was a within subjects with pre-post-test group design, and the setting was in the participant's home.
Yeah, right. The materials used were smartphones or a tablet that were owned by the individuals. We used the Smiling Mind application, which they downloaded from their phone. The DOS survey was used, and we also told them to go to a calm environment where they were free from distractions.
Okay, our instruction manual was a task analysis. The first step was to complete the DOS self-report survey. The second step was download the free Smiling Minds app on your smartphone or tablet. And number 3 was to find a quiet place away from distractions. Then participants were to listen to the 10-minute mindfulness practice 2 times a day for 5 days. After this, they would complete the DOS self-report measure again, and then they would complete a social validity measure.
The results. For the depression, Jake scored a 5 on the pre-test, and on the post-test he scored a 3. Angela scored a 12 on the pre-test, and it decreased to 11. Sarah's pre-test score was 20, and it decreased to 17. Nicole's pre-test score was 11, and it decreased to 7. All 4 of the participants had a slight decrease in their scores after the post-test. For the stress scores, Jake's pre-test score was 20, and it decreased to 15. Angela's pre-test score was 28, and it decreased to 21. Sarah's pre-test score was 36, and it decreased to 32. Nicole's pre-test score was 15, and it decreased to 12. All of the participants had a decrease in their stress after completion of the pre-test. For anxiety, Jake's pretest score was 12 and decreased to 10. Angela's pretest score was 18 and decreased to 16. Sarah's pretest score was 16 and decreased to 11. All participants had a slight decrease in their anxiety scores as well.
Okay, here are social validity results. The questions we asked were if the mindfulness meditation is important for everyday living, and they scored this out of 5. The median response was 3.5, which is about average there, so they did think it was important. Smiling Minds is a good way to practice mindfulness. All participants thought pretty highly of this. Smiling Minds is better than practicing mindfulness with an instructor or researcher physically present. This one, the mean score was 2.5, which kind of indicates that participants were unsure. And overall, they reported a satisfaction with the mindfulness experience. 3.5 was the mean for if they would continue using the Smiling Minds app. And the mean score for recommendation was a 4.
Moving on to the discussion. Brief mindfulness meditation was effective in lowering all 4 participants' depression, anxiety, and stress according to the DAS self-report measure. These results add to existing literature suggesting mindfulness is an effective treatment option to reduce stress, anxiety, and depression. Overall, participants were satisfied with their mindfulness experience using Smiling Minds and would recommend this app to a friend.
All right. A few limitations to our study. With self-report, we couldn't control for external variables in the environment. We have small sample size, and the responses we had were biased. And we performed a brief intervention. It wasn't an extensive intervention at all. And we did not ask the participants if they received treatment for depression, anxiety, or stress before they took our mindfulness exercise.
Okay, for future research, we can compare the effectiveness of Smiling Minds meditation to ACT or AIM curriculum. We could conduct this study in a stricter environment like a therapy room instead of in the participant's home. We could administer mindfulness one-on-one. And finally, we could utilize participants who already have a pre-existing diagnosis of depression or anxiety. And here are our references. Okay, thank you.